All right, good afternoon, everyone. In an effort to catch us up, I've decided to do a quick video lecture on what the remaining topic was for this week, and that's the biological development in infancy and childhood. We're going to keep it to about 10 or 15 minutes. The book does a great job of talking about biological development, that biology part of the biopsychosocial. It's not to turn you into an expert on this level of development, but at least to start planting some seeds and to give you a foundation to move forward. So what we're going to be talking about is really looking at the life course clock, as we call it. So we mentioned earlier about the life course perspective. Well, this is a kind of a neat way to think about it, the life course clock, or that life course from conception to death, if you will. We're going to look at some of the typical physical development stages from conception through school age. We'll talk about factors that shape infant-child physical development, how this may influence other developmental elements, and hopefully some solutions and social work's role in this process. Again, the book covers most of this. We're just going to add to it. And that last item, we're actually going to be doing some in-class assignments that really look at this, the social work's role. Well, let's talk about the life course clock. As you can see with the image, is it gives you a nice outline of that life course, but in sort of a round analog clock. So we've got from the fetus to nursing baby to toddler to child, adolescent, and you can see all the way around from established aging to aged elderly. What I like about this is so much of the time we focus on development ending at adult. A lot of early psychologists and developmental folks really believe that our development occurred from the child on, or I should say actually ended at the child stage. So what I like about the clock is it really looks at more. It moves beyond just this child level stage of development. Again, some early psychological theorists believe that really our development was pretty much done as far as the psychological and social development. So we've got some terms that we use just so we're using the same terms as the other disciplines. And when we talk about this early part of the life course, there are some labels that we use. And you can see that here from 1 to 2 weeks, zygote, embryo, and all the way down to neonate tends to be the first month of life. Newborn is the first 2 months. Infant is the first 2 to 12 months, and then a toddler is 1 to 3, and so forth. We're really just going to go to this first, to the preschool toddler phase. The toddler preschool age, and not too much further. Okay? All right, well, let's keep going from here. So lifespan, the beginning. We know that, and you're wondering, as we go through this, I'll interject some things about social work's involvement. Prenatal, even before conception has begun, we know that there's a number of things we can do as social workers and as healthcare providers to improve the life course, to improve the quality of life of people that we work with and communities that we work with. We know about nutrition and the importance of that even before people have babies, that's essential. We're going to talk about one piece of nutrition that's become very important. We know the effects of drugs and prescriptions. Oftentimes when children are born or infants are born addicted, that's the most immediate sign. But there's other effects on taking either illicit drugs or even prescription drugs that can have on the unborn child and later on the infant. We know the effects of alcohol. Now in our culture, we frown upon pregnant women consuming alcohol. But it hasn't always been that case, and it isn't always that case in different parts of our culture or in other cultures. Drug abuse, addiction, smoking. We know the optimal time for pregnancy is really physically between the ages of 16 and 35. Yes, people in their late 30s and 40s, and there's even been 50-year-olds can have children, but we know that past 35, you hit it becomes higher risk for both the mother and for the developing fetus. And lastly, we know that maternal stress, the stress of the mom to be, has an impact on the ability to get pregnant, um, the pregnancy itself, and then actually delivery and later parenthood. Conceptualization is, we would think, would be fairly simple. It seems to happen pretty easily for a lot of folks. But it can be very difficult for a number of couples. And oftentimes, those are folks that we may be working with because of the stress to conceive or the difficulties they've had in conceiving a child. It's hard on the marriage, it's hard on their relationships, it's hard on their families and their loved ones. So, social work can be involved in those difficulties. Now, a lot of the conceptualization challenges that occur are addressed by medicine, but you can certainly, as I was mentioning, you can see that the psychosocial elements do call for social work involvement. We know that gestation is tends to be it should be 40 weeks. That was a catch. It's 9 months or 40 weeks. Typically in medicine, we talk about 40 weeks. So again, this right here is 40 weeks, and it's for 9 months. Normally, most women, the average or the expected weight gain is 25 to 35 pounds. That's the average. It can be more, it can be a little bit less, but this is what they need to be striving for. To do that, you need a good 300 to 500 additional calories. That's it. That's all that's needed. They can be plus or minus a little bit based on your needs and the baby's needs, but that's pretty much what's needed. Most people gain more weight and consume more calories than are needed during pregnancy. Oftentimes, there's a lot of stress eating that's involved. And we know that excessive weight gain is hard on the mom and hard on the developing fetus as well. Some of these things you can read on your own. I'm going to point out a couple other things. Two things that are important in social work, especially in assessment, and you'll get this in practice one, is gravida para. That is a tremendously important piece of information that we can get about any female. Gravida is the number of pregnancies, so the number of times a woman's become pregnant, and para is the number of live births or viable offspring. So if you have someone that is gravida 4, para 1 in their physical history, it makes you wonder what happened to those other 3 kids. Were those spontaneous abortions? Were those miscarriages? Were those abortions themselves? What exactly was going on? And that's something that a social worker is going to delve into and find out. Because it can indicate a lot of other problems happening. It's funny with APGAR scoring that's done usually immediately after delivery of the baby, then I believe 10 minutes later. The range is 1 to 10, and on page 59, the book does a good job of describing that. No one's infant is going to be rated a 10 unless it's another obstetrician's baby. So no one gets a 10 in life unless you're a doctor's infant. And so you can see the rest of these terms are pretty straightforward. I would direct your attention to problem pregnancies, pages 54 to 55, and the discussion there about the problem pregnancies that can occur for people. Now, I want to talk about folic acid, and there's a short video we're going to hop to really quickly, and that we're going to watch on folic acid and the importance of that prenatally, and how that was something that social work and legislators actually pushed to include in a number of food products, in particular into baked goods. So we are going to hop on over. I tell you what I'll do is I'm going to make that video a link. It's about 3 minutes and 27 seconds. And so you can pause this video lecture and go to that. That link will be right underneath this YouTube link on Blackboard. So then you can take a look at that. Okay. So again, that's right here. Let me show you what it's going to look like when you get to it.
Having a baby anytime soon, folic acid has long been known to help us all maintain a healthy lifestyle, in particular those who are looking to get pregnant.
Well, the British Pregnancy Advisory Service is calling on health ministers to fortify our flour with the essential vitamin, saying that it could prevent 1,000 pregnancies being affected by serious defects each year in the UK.
I love how they say vitamin, but the folic acid is something that women, in the United States, we include it. It's in our fortified flour, and so it's in all kinds of bread products and pastries and pastas and things like that. And here's what that will do. It needs to be there. Folic acid needs to be taken, or assume, making sure that you should be able to get enough with all those other products. And this is a public health measure, because without it, the risk for a number of problems for kids is huge. One of the things that's spina bifida, the rate of spina bifida among infants is significantly higher when folic acid is not present. Anencephalopathy, which is a very sad condition. I didn't want to post any videos of it. It's where the top of the brain is not fully developed in the newborn child, and so the life expectancy is really in weeks. They're very deformed. Some live for a couple of years, but basically that the whole top of the brain is not there, and they're unable to develop any advanced thinking because the brain just isn't there. Usually it's just the brain stem, and that will help you. The heartbeat, the lungs will work, but it's a very sad condition. So anencephaly and spina bifida are two conditions that can be almost eliminated simply by making sure that folic acid is present in our bread products, or the person who's planning to get pregnant is taking a multivitamin before that happens, or a prenatal. Okay, let's go on to the next. Critical periods in human development. I have just to give you an idea in early development what's happening. From the essentially from 0 to 38 weeks, which is full term. 40 weeks is really where we want them. I love this graph, and I'm going to give you a handout of this graph, and you can print out this in color, but it gives you a quick visual of how that child develops, how that infant, that zygote, that embryo, how it moves from embryo to fetus to infant. It really makes you appreciate that development and how quickly it occurs. For that neonate, because usually when they're at this stage, social work's not as much involved with, with the fetus or with the baby. But when they get this point, we definitely are involved in the neonate or newborn from 0 to 8 weeks. The average full-term birth weight is about 7.5 pounds and about 20 inches long. I think the world's largest baby was born at 14 pounds. That's amazing. I remembered when I worked delivery in New Orleans as a social worker, that our largest baby that showed up was about 11 pounds. And that was a regular or vaginal delivery. So that's a big baby. Babies pretty much at newborns, they do 3 things. And most of you that have them know. They sleep, eat, and poop. That's pretty much it. There's not as much interacting, and that's the bulk of their life. They're just trying to put on weight and to grow. A big debate that's been going on is the formula versus breast milk. There's the La Leche League. You can Google the La Leche League, and they are sort of the breastfeeding Nazis, if you will, which is a good thing in a lot of ways. I'm being kind of facetious, but there's a lot involved with breastfeeding, and a lot of women just don't have the time or energy. And it's breast milk is firstly the colostrum, which is the first milk that occurs in the first couple of days, is highly valuable to that newborn. And so oftentimes, even if a mom is deciding not to breastfeed, they'll get that first colostrum, that first milk in the beginning, and it does wonders. There is actually a lot of challenges with lactation. Breastfeeding is not natural. I mean, you'd think baby comes out, baby latches on, and it's all good. But as many of you have experienced, and I have as a clinical social worker in working with newborns and their mamas, is that it's not natural. The baby and mom have to learn how to do it. That's why there are typically nurses who are lactation consultants and work with mom and baby to learn and to go through that. You're tired, you're exhausted, breastfeeding's not natural, or maybe your milk hasn't completely come in, and so it can be very, very anxiety provoking. And that's where my job was, to work with the lactation consultant and the new parents and deal with stress management and issues, and even some of the mechanical issues as far as, where do you get a breast pump? Where can I breast pump? How do I make sure my job has accommodations for that? Those are all things that a social worker would be involved in. What reflexes should be present in a newborn? Love this graph because it shows you right away the things that we should be seeing. You'll see that rooting complex, which is kind of involved with the breastfeeding. When that baby is looking, you stroke their cheek and they're going to move to that. They're trying to find that nipple so they can get fed. Gripping is another kind of a reflex that we should see in our newborns. Toe curling is another common reflex that we should see. The Moro or the startle response, sudden noises. The infant has a very prescribed response. It will throw its head back and arms and legs, and then cry. And a lot of this is not that they sense danger necessarily, but it's a neurological response. They haven't learned about danger yet. What they know is it's a sudden response in their neurological system. So all of these are kind of, they're inborn, they're natural, they're instinctive reflexes. The Gallant response is when stroking the infant's lower back next to the spine. It will actually curve the side that was stroked. So again, these are things that we see, that we expect to see in our newborns, and if they're not present, it would involve the pediatrician or developmental pediatrician to explore why they're not there. Another wonderful graph that I wanted to share with you, and I'll be giving this out as a handout, and it will be available on Blackboard as well, is it shows the physical development from birth all the way through 5 years. And it's a really nice handout that you can share with your clients, and just gives a really easy portrayal of what we should be seeing. Here you see the grips finger, lifts head part of the way up, moves or cries to loud noises. When we get into like the third, fourth month, begins to reach towards objects, enjoys bright shapes and colors, responds to mother's voice or father's voice. At 9 months, rolls over and easily in play. So about 9 months, they should be rolling over. Pulls to standing, eyes focused on an object. When we hit 1 year, they should be taking steps. Some people are very proud that their child, their infant, their baby is able to start walking at that time frame. And some pediatricians will say that's too soon. Prior to 1 year, the body physically hasn't developed. And so again, it's okay if it takes a little bit longer into 14, 15 months. And again, you can move forward with that. We've got another really nice video, and again, the link is going to be on Blackboard that I want you to take a look at. Let me show you what it looks like really quick.
Baby month-by-month development and growth after birth. 1 month old baby. What an amazing first month for you and baby. It's hard to believe how much your day-to-day has changed now that this beautiful and confusing person has entered the world and turned your life up.
Okay, so you see what it looks like. The video will be underneath this one is a link. It's a little less than 12 minutes and does a really nice review. Again, why social workers need to know this stuff with basic physical development is so we know what's normal. We're not necessarily going to diagnose the problems, but we know what's normal and when we can refer our folks out. And if you think you'll never be doing this part, think again. My wife actually ran an early intervention clinic, and those are federal clinics that deal with this type of development and actually with the psychological and social, but mostly physical, to folks 5 years and younger. They're federally funded. They involve a developmental pediatrician, a developmental psychologist, and a clinical social worker. And Marla was actually trained to do some of the physical testing, the fine motor skills, the gross motor skills, to do this type of assessments. It's called the Denver assessment. So really neat. So again, this is a nice handout. Now let's hop back on here and go to the next. Here's another handout that we have. Again, I'm trying to give you tools that will be useful. What we see, we've got gross motor skills and fine motor skills. And so you can tell right away, if we focus on, this goes all the way through 5 years. If we biologically, we're just talking about that gross and fine motor skill. So you can see birth to 6 months, lifts head, turns around when lying on stomach. That's a big thing. That baby turns over. We're always very excited. Rolls over from back to stomach from 6 to 9 months. Crawls around on hands and knees 9 to 12 months. Walks around furniture or crib while holding on. That's what we really want to see from 9 to 12 months. They don't start standing without support or walks without help until about 12 to 18 months. Again, the physiology, their bodies are going to be more capable of physically doing that, and then actually running towards the end of 18 months. A really nice handout, short, simple, to the point. When you work with kids, you can see these things. And actually, when you do your observations of different populations, you'll be able to use this and to identify which kids are on task or developmentally appropriate, and which are maybe showing some delay. I love this at the bottom. Remember that children develop at different rates, and this is only a general guide. Another, if you've had kids, you know exactly what these two graphs are. It is our percentiles for development. And so when we talk about a child being in the 90th percentile for height and weight, they're different for boys and girls. So say if you've got a 5-year-old and they're in the 90th percentile, here's the percentiles. Follow the line down to about the 5-year-old. That would mean at the weight, they are at the 90th percentile, if I got that right, that upper line. They're going to be about 45, about 45, 48 pounds in weight. And that's for a 5-year-old, 90th percentile, way up at the top. And 90th for height, which is up here at the top. For a 5-year-old, is going to be about 45 inches. Again, this gives you what's expected. As long as they're within these percentiles, the 90th on down to the 25th, they're in the range that's appropriate for boys and for girls. So again, knowing, because you can calculate the body mass index. Obesity is a huge problem among children these days and with teens. So much so that type 2 diabetes, which used to be called adult onset diabetes, is no longer called that because there's too many children and infant that are being diagnosed with type 2 diabetes because of obesity. So that's pretty amazing. So again, these two graphs are used throughout pediatrics. Anyone that's had a kid has seen these and lived by these. And so they're very important to be familiar with and to know how they work. Again, it's really simple. You find the child's age, where their weight, and it will show you what percentile they're in for height and for weight. And then body mass index is very simple to calculate and to graph. Let's talk about some key real-world milestones. This is kind of from my perspective, but also from the literature. I think one of the biggest milestones for us was eating real food. Kind of before that was getting formula. Here's why. Because when that infant gets that first dose of formula, it is so much heavier than mama's milk that they sleep through the night. It hits their stomach, they're more satisfied, it's more filling. Is it better for them? The jury's still out on that one. The next is when they start eating real food, because you get tired of buying formula all the time, and it's just a lot of fun feeding an infant or feeding a toddler. So it can also be very messy and annoying, especially when they learn the word no. So eating real food, that's a big milestone. It also adds another layer of change for the families. Keep in mind, raising kids and all of this stuff is very new. And those of you that have had infants or cared for infant siblings know that there's a lot of stuff to learn with this. It doesn't just come naturally. The second big real-world milestone is sleeping through the night and sleeping on their own. That's the second thing we really assess when working with families and with kids is, are they sleeping through the night? Are they going 6 hours or 7 hours? Because that can be really detrimental to the family as a whole when that baby's waking up, after 2 or 3 hours or in the middle of the night. Now, breastfed babies, again, because that breast milk isn't as heavy as formula or real food, they are going to wake up every 2 hours to be fed because that's expected. Sleeping on their own is important too. There's mixed research about the benefits of infants sleeping with in the marital bed, sleeping with mom and dad or sleeping with mom. It goes back and forth from Dr. T. Brazelton to Dr. Spock to the other folks that have been sort of the gurus in raising infants and children. So much of it, though, is there's other reasons sometimes for why that child is sleeping with their parents. And so again, sleeping on their own is something you have to investigate because sometimes it's not necessarily done for the infant. Sometimes it's done for the parent themselves. So we have to explore that. Talking, use your words. That is awesome. How many times have we all said that have had kids? Using your words is great because then they can tell you what hurts. What do you want? What would you like with your Happy Meal? What would you like to do right now? How does that make you feel? Talking is a wonderful thing. Fourth, this is kind of more of a behavioral, psychological thing, but I put it here, pooping in the potty. Man, is that awesome. When that toddler can start pooping in the potty, it is awesome because it means you're not going to have to buy diapers anymore. Or if you're, using cloth diapers, you're not going to have to clean those things out. So that's a big deal. It's how they express a lot of their autonomy and their control, whether they're doing that or not doing that. Sometimes they'll show you control by saying, well, I'm not going to poop in the potty. I'm going to poop right here. So it can be a great developmental challenge. I know with my son Nevin, and I'll deny that I ever said this, it took us so long to get him to poop in the potty. We had at least $100 worth of toys and rewards for him to poop in the potty. So again, that's a big thing when you're raising kids. Lastly, the ability for self-care. When those kids are able to do more and more for themselves, it relieves a lot of the pressure on the parents. So when they're physically able to do that, again, these are also these are some psychological or milestones, but actually also have a connection to the physiological aspect as well. For instance, sleeping through the night and enuresis used to be, we're bedwetting. We used to believe that there were some psychological aspects, and we would go into that, whether, from the toddler stage on. Most of the research now with enuresis has to do with their physically, their nervous system is not waking them up to go to the bathroom. They sleep so soundly that it's not able to do that. And so that's something that you can actually train your child, and there's techniques to do that. So again, it's a big issue, and it can be a frustration for parents when their child's not sleeping through the night or is having that bedwetting, and there's plenty of solutions to that. That's all I've got. I know it was much longer than I had thought, but it will get us on track for next week, and so we can move into the psychological aspects of development. Okay, I hope this works. Leave comments and let me know what can be better, and I will see you next time.